Skill. I have my supplies, a pre-filled flush syringe of 0.9% sodium chloride, an IV needle, an IV start kit, extension tubing, and clean gloves. For practicing purposes, these supplies are already open, but I'll continue as if they are unopened. My client will be receiving IV fluids. The location of insertion site for venipuncture is on the forearm right here. I'll begin by performing hand hygiene and applying clean gloves. Then I'll prepare my equipment on a clean, clutter-free bedside table. The needle I'll be using is a 22 gauge 1-inch needle. Dispose of this. Dispose of this. Now I'll prepare the extension tubing. Uncap. Dispose of this. Grab my syringe. Uncap. Dispose of the cap. And connect. Now on the other side, I'll remove the cap. Dispose of the cap. And prime the tubing to remove any air. I apologize. I need to unclamp first. Now I can prime. The air is removed. I'm going to reclamp and set aside to be attached to the catheter hub. Now, with my client's forearm, I'll grab a tourniquet and apply the tourniquet about 4 to 6 inches above the venipuncture site. I've applied the tourniquet. I'll make sure that I don't apply the tourniquet too tightly, and I'll check for a peripheral pulse distal to the tourniquet. A pulse is present. Now I'm going to take an alcohol swab and apply it directly on the venipuncture site in a circular motion moving outward. Dispose of this and allow it to dry completely. I can now take my needle, making sure that the bevel is pointing upward. I'm going to use my other hand, my thumb of my other hand, to 1 to 2 inches below the venipuncture site and hold the skin taut in the direction of the insertion. Now at a 10 to 30 degree angle, I'm going to insert the needle and observe for blood return. I have blood return. I'm going to advance 1/4 of an inch. Now I'm going to stabilize with my non-dominant hand the VAD, and I'm going to gently push off until the hub is at the venipuncture site. Now I'll retract the needle by pushing the button to put it back into this, but due to practicing purposes, I'll pretend that I did this, but for the purposes of this video, I would hit this button to retract the needle and dispose of this in the sharps container. This is my sharps container. Now I'll remove the tourniquet and apply a sterile dressing just over the insertion site. I apologize. Now I will apply the tubing, making sure not to touch the sterile ends of the cap. Unclamp. I'm going to retract to check for blood return. I have blood return. Now I'm going to slowly insert the solution. For the purpose of this video, I have fully inserted the sodium chloride. Now I'm going to remove this and dispose of this while stabilizing the hub. Now I'm going to apply a sterile dressing just above the hub. In real life, I would remove this backing and apply it to hold it stabilizing, but for practicing purposes, I'm keeping the backing off. But this would be taken off and stuck right here, right above the insertion site. Now I can take a piece of tape. Sorry, taping issue. And loop the IV, stabilizing it with a piece of tape. And then I would initial, date, and write the gauge, the 22 gauge 1-inch needle on the sterile dressing. And I've inserted my IV catheter. Now I can remove any supplies and discard them appropriately. Then I'll remove my gloves, perform hand hygiene. Now for coming back to remove the IV, I have clean gloves and 2 gauze and my tape, which I will prepare. In real life, I would not prepare tape this way, but for the purposes of this video, I'm just making sure I have it ready. Okay, now perform hand hygiene. Apply clean gloves. These gloves are a bit smaller, they just ripped. I would put on a new pair of clean gloves for this, but for the purpose of this video, I'll continue as if they're not broken. I apologize. Okay, now that I'm going to remove the IV, I'll stabilize the catheter, slowly remove the tape, dispose of this tape, loosen the IV, gently, slowly remove the dressing while stabilizing the IV with my other hand. Dispose of this and grab a sterile gauze, hold it above the IV and gently remove the IV. Now I'll inspect the IV. It is 1 inch and it is in good condition. Now I'll dispose of this in a sharps container. I'll hold the dressing on for 30 seconds or until the bleeding has stopped. The bleeding has stopped, I'll dispose of this. Grab a clean sterile dressing. Apply gentle pressure. Grab my tape and tape down the dressing. Now I can remove my gloves. Dispose of this. Remove any equipment needed. Everything's in the sharps container. Everything's put away or disposed of properly. Perform hand hygiene and document the procedure. Done.